It's the first time in headache field that we have such a large number of trials with a drug for the prevention of migraine. And if we consider all the randomized control studies, phase 2b and phase 3, of molecules used to prevent migraine, but also for the acute treatment, and I mean CGRP targeting treatments, we have 25 trials and 24,000 patients included. So really a very large amount of patients considered. These trials involved 4 monoclonal antibodies, erenumab, galcanezumab, fremanezumab, and eftinezumab, and also 2 gepants, atogepant and rimegepant. And these trials included and considered a large series of patients and also different clinical scenarios. Patients affected by episodic migraine, by chronic migraine, and also those patients affected by episodic or chronic migraine with prior treatment failures from 2 to 4. Fremanezumab was also studied in randomized control studies in the children, so in pediatric population, and also in patients affected by comorbid major depressive disorder. The main results: half of the patient reach after 3 months on average at least 50% reduction in monthly migraine days compared to baseline. And 1/3 of these patients, after only 3 months, reach a 75% reduction in monthly migraine days compared to baseline. The proportion is slightly less for patients who had failed from 2 to 4 prior preventive treatments. But this is the efficacy. What about the tolerability and safety? Very good result indeed. And I would say very good result indeed, mostly for monoclonal antibodies, but for all these trials, so monoclonal antibodies and gepants, the proportion of adverse events was similar in patients treated with the active drug and in those treated with placebo. What the randomized control study demonstrated is a slightly higher proportion of gastrointestinal symptoms, including nausea, constipation, or anorexia or weight loss in patients treated with atogepant, but with a very, very low discontinuation rate. What did the real-world evidence study add? For the first time, we noticed that actually these drugs work in real life even better than that expected from randomized control studies. And indeed, these studies were mainly carried out in Italy, where we have a registry, and so these trials have been prospective multi-center studies. And we documented that up to 75% actually respond within 3 or 6 months, with an even lower proportion of patients with adverse events. We also documented that in real life, they may happen a late or ultra-late response to monoclonal antibodies, and this points to the need of keep treating patients, not stopping after a short period of time.